I want you to introduce to a great woman, my mom. When I was in MIT, I was helping a group of hospitals to understand how technologies could help people with diabetes. And as I was getting very excited about all these technologies, I started talking for the first time with my mom about her diabetes. She was seeing one of the best endocrinologists in the city, in one of the top hospitals in the country. But I was shocked when I realized how lonely she was, how she was struggling to manage her disease. And at some point she said, I just want to give up. So then I said, well, if she has some kind of insurance, what's happening with people without insurance? What's happening with the rest of the population without access to specialized care? And it is a catastrophe. And unfortunately, even that no one is immune to diabetes, low-income people suffers the most. Diabetes is a catastrophe. In Mexico alone, there are 14 million people with diabetes. It is one of the leading causes of death, blindness, amputations, kidney failure, and even suicides. So, and this story is not only in Mexico alone, it's everywhere in the world. Most of the countries are shooting the alarms that diabetes is rising exponentially. And the problem also is that in diabetes care, money matters. Low-income people will have 4 times more complications. They will have 15% less information, and it could be even 50% of their monthly income. So what's happening? We have the best schools, we have the best doctors, we have the best medications. So what is missing? And what we are missing here is that we cannot take the solutions from developed countries to emerging markets. Let's take, for example, Nigeria. For Nigeria to catch up with the same number of doctors per capita as the OECD economies, they will have to develop 12 times as many doctors by 2030. This will take more than 300 years with their current infrastructure. Or let's take Lupita. Lupita lives in Monterrey, Mexico. She makes about $200 a month. She also takes care of her grandchildren. She needs to take a 1-hour bus to reach to the clinic. So how do you deliver care to these populations? And the answer is, we need a system change. We need to realign the incentives. We need to redesign the supply chains. We need to start partnering and collaborating, governments, private companies, innovators, in a way to how we can start from scratch and how we develop the systems that these people need. But every time that I'm in forums like here, like Davos, we always think that we will have this miracle cure and something is going to happen, and then governments will be very interested, and innovators will be taken, and private companies will be very interested in how to go to low-income people. And that will not happen. We need to work hard, and we need to make the commitment to work together. And that's the work we're doing at Clínicas del Azúcar, or sugar clinics in Mexico. Clínicas del Azúcar is a low-cost, one-stop shop for diabetes care. And we have this dream that specialized care should be accessible to all, that money should not matter if you get good care or not good care. So what we have done, so the first thing is we thought about what a patient with diabetes needs, and we redesigned the complete processes around that. So we create a one-stop shop, everything in one place and everything in one visit. The patient goes station by station, and with different technologies, softwares, and predictive algorithms, we create efficiencies around the care. So it is easy, instead of training more doctors, to increase the productivity and the efficiencies in where the doctor is getting involved, where nurses and where the different actors in the healthcare providers act. And also, we have starting the discussions with pharmaceuticals, with governments. How you do it? What is your price strategy? What are the innovations? How government should be involved? How different nonprofits should be involved? How education should be delivered? So this is the dream. This is what we're doing. We have more than 5,000 patients now, 5 clinics, and scaling. And the dream, accessible to all. Thank you.